Croesawu pawb i'n briefio a newidiadau ysbyty Neuadd Nevill. Welcome everybody to our briefing session today on changes to Nevill Hall Hospital. My name's Adrian Osborne and I'm the Assistant Director for Engagement and Communication with Powys Teaching Health Board. And before we start today's session, I just wanted to provide a brief technical introduction. Understandably, with the restrictions in place due to COVID-19, we're now using more digital means to engage and communicate with our communities, and so we've started using Microsoft Teams live event as a way to hold briefing sessions such as this one today. This means that not only can you watch it now online, but it also be recorded for future use. And don't worry, as attendees, your identity, your presence here isn't recorded. The element that's recorded is my presentation today and any other participants that you see on screen during the meeting or here during the meeting. Now on your screen you should see a tab with a question mark on it, and that allows you the opportunity to participate in today's briefing session. You can pose questions during the briefing and we'll have the opportunity to answer those questions towards the end of the session. Also, depending on your language needs, then a range of subtitles will be available if you use the settings button on your screen. We've got subtitles available in English and Cymraeg and also available in Arabic, Polish, Bulgarian and Urdu. So those are automatic translations provided by the Microsoft Teams system today. So as I mentioned, today's meeting is being recorded. So that also means that any colleagues who weren't able to join us today will also be able to watch it at a later date, and we'll be publishing that on our YouTube channel and also on our website. So thanks everybody for joining, and I'll now start today's presentation. So today I wanted to share with you some information about changes to services at Nevill Hall Hospital in Abergavenny. So if we can go to the first slide, please, Tim. So first of all, I wanted to provide a little bit of background about why we're in this situation here today. So Nevill Hall Hospital will be changing on the 17th of November. And the main background to this is something called the Clinical Futures Consultation. And that took place in 2007, and it set out proposals for the future shape of hospital services and wider health services in the Gwent area. And following that consultation, a decision was made to establish something called a Specialist and Critical Care Centre near Cwmbran. And that facility is now known as the Grange University Hospital. And as part of that decision, it was agreed to refocus the other hospitals in the Gwent area as local general hospitals. And this meant that that would include the transfer of some services from the Nevill Hall Hospital in Abergavenny and from the Royal Gwent Hospital in Newport to the new hospital once established. So all of those services in Gwent are now the responsibility of an organisation called Aneurin Bevan University Health Board. They're responsible for the delivery of services across Gwent, including Blaenau Gwent, Caerphilly, Monmouthshire, Newport and Torfaen. So next slide, please. So the next stage in the background, it was called the South Wales Programme, and some of you may remember that in 2013 there was a major consultation called the South Wales Programme on the future configuration of consultant-led maternity and neonatal care, on inpatient children's services and emergency medicine for South Wales and South Powys. And one of the key drivers for that consultation was the recognition that it was becoming increasingly hard to sustain safe 24-hour services in those particular specialties and some of the key specialties in hospitals that supported them. The programme approved a 5-site model for consultant-led emergency medicine, maternity, neonatal and inpatient children's care. And those sites were identified as the University Hospital of Wales in Cardiff, Morriston Hospital in Swansea, the Grange in Cwmbran, Prince Charles Hospital in Merthyr Tydfil, and the Princess of Wales Hospital in Bridgend. And the Prince Charles Hospital in Merthyr Tydfil was recognised as part of that consultation as being of particular importance. With changes taking place in Gwent, the Merthyr Tydfil Hospital would be particularly important for our residents in South Powys as the acute care network that would become the nearest district general hospital for many of our population here in South Powys. And after that consultation, the South Wales programme recommendations were supported by all 5 of the health boards across South Wales and also by Welsh Ambulance Service. And our health board endorsed those recommendations at its board meeting on the 13th of February 2014. So next slide, please. Bringing some of that background a little bit more up to date, we as a health board have our strategy for a healthy caring Powys. That's a joint strategy between ourselves and Powys County Council, where we worked together with our communities, staff and partners to develop our vision for a healthy caring Powys. So that involved listening to thousands of voices across our communities and our staff and our partners. It sets out a shared vision for the future. And more information about this is available from our website if you'd like the detail of it. It sets out our shared ambitions between us, the council, the third sector and other partners to support people to start well, live well and age well. And as part of that as well is our own ambition to seek to provide even more care closer to home than we currently do. For example, building on the services that we currently provide in Brecon Hospital for diagnostics and minor procedures and outpatient appointments. Next slide, please. Now, more recently, something's happened that certainly none of us might have envisaged this time last year. So originally it was planned that the Grange University Hospital would open in spring 2021. We were planning that during this year we would have had ongoing programme of engagement through the spring and the summer, and moving into the autumn and winter we'd be focusing on a communication campaign to let people know about the changes happening next spring. However, during this year we've seen COVID-19, unprecedented circumstances, one of the biggest public health challenges that has ever faced the NHS since it was established. And as part of reflecting on our experience of COVID-19 during the year and looking ahead to the challenges we know that we will face going into the winter, an Bevan University Health Board recommended that the opening of the Grange should be accelerated to November 2020. So they made that recommendation at the end of the summer, and it was supported by health ministers at the end of August. So that's a very recent decision to accelerate that opening of the Grange, which also means that the move of services from Nevill Hall Hospital to the Grange will be happening earlier than we'd anticipated. And specifically for us and our communities, from 17th of November, the Grange University Hospital will become the main location in Gwent for 24/7 accident and emergency services, 24/7 paediatric services, 24/7 consultant maternity and neonatal services. And those services will transfer there from Nevill Hall Hospital and also from the Royal Gwent. Now that date is due to be the 17th of November, but we recognise that we are in changing and challenging times, so it is possible that that date could be subject to change in the context of COVID, but that's certainly the date that we are all working to for the main service move at the moment. There are some slight changes for different services, which I will come to later. Next slide, please. So on this slide, there's quite a lot of detail here, but it sets out the information about the services that Nevill Hall will offer from next month and what it won't offer. So it will continue to provide a 24/7 nurse-led minor injury unit. It will offer a medical assessment unit. So that's the kind of facility where if a GP or one of our hospital doctors or another professional finds that maybe an elderly relative of ours is seriously unwell and needs some rapid tests and diagnosis in a hospital environment, the medical assessment unit is the place that people would be referred to for that. The medical assessment unit at Nevill Hall Hospital won't operate 24 hours a day, but will be able to accept admissions during the main working hours during the day. Nevill Hall Hospital will continue to provide day surgery as well. This is surgery where you're operated on and discharged on the same day. It will continue to offer rehabilitation and therapy services, wide range of diagnostic services as well, assessments, scans, x-rays, MRIs, CT, wide variety of the specialist outpatient clinics. So a lot of the reasons that many of us would go to Nevill Hall Hospital today will be unchanged. A lot of that planned care will still continue to be provided from Nevill Hall Hospital in Abergavenny. It will provide frailty care for older people. It will still have inpatient beds, outpatient appointments for children, and for maternity services, it will provide outpatient services in a midwife-led birthing unit. But that means, as we've said, there are some critical services that Nevill Hall Hospital will no longer provide. It will no longer provide a consultant-led accident and emergency service. It will no longer provide inpatient surgery requiring overnight stay. It will no longer provide consultant-led births and neonatal services. And it will no longer provide inpatient children's services and paediatric assessment services. And it's important to remember, though, that those services will continue to be available for residents across South and Mid Powys from neighbouring hospitals. We have strong relationships with many of our neighbouring hospitals in neighbouring counties and health boards in Wales, and so those will continue to offer the services for our residents, and that includes Prince Charles in Merthyr Tydfil, Hereford County Hospital in Hereford, Glangwili in Carmarthen, the Grange University Hospital in Cwmbran once it's open, Morriston and Singleton Hospitals in Swansea, and also Bronglais General Hospital in Aberystwyth. Next slide, please. So currently, across South and Mid Powys, we might access our District General Hospital services from those hospitals listed there. So as of today, Nevill Hall Hospital is still on that list. But if Nevill Hall Hospital is currently your nearest hospital for consultant-led A&E services, maternity and children's services, then this will change on the 17th of November. And for most Powys residents who are currently closest to Nevill Hall Hospital, they will in future be closest to the Prince Charles Hospital in Merthyr Tydfil. So this isn't about our residents having to go to the Grange in Cwmbran. For most residents, Prince Charles will become the closer hospital. Clearly for some of our residents, particularly in the mid-east of the county, for whom Nevill Hall is currently their local hospital, then Hereford would become closer as well. So depending on where you live in the county, you'll have a new local closest A&E. Next slide, please. So clearly one of the biggest things for all of us going into these changes is to know where to go for emergency and urgent care from the 17th of November. And obviously the most critical part of that is to dial 999 for life and limb-threatening illnesses and injuries. So our colleagues from Welsh Ambulance Service and from Wales Air Ambulance and from EMERTS, the Emergency Medical Retrieval and Transfer Service, are there to provide access to treatment and transport if we're suffering the most serious illnesses and injuries. Dial 111 when it's urgent but not life-threatening. The 111 service in Wales is also provided with Wales Air Ambulance. So that means that if we're not sure, if we dial 111 and it's actually a life-threatening illness and injury, they can very quickly transfer us through to 999 and vice versa. So 111 is there with trained call handlers to be able to provide us with advice 24 hours a day when we're not sure about urgent illnesses and injuries that are not life-threatening. Obviously, sometimes we will want to go straight to an A&E, so it's important for us to know where our nearest A&E will be from the 17th of November, and that will vary depending on where people live within Powys. So as I mentioned earlier, for many of the people for whom Nevill Hall is currently their closest A&E, it will in future be Prince Charles Hospital. For some of our residents in Mid-West Powys, around Llanwrtyd Wells, Glangwili General Hospital remains their nearest A&E. For many of our residents in Mid-East Powys, then Hereford County Hospital remains their local A&E, and as well as that, some residents who are currently closer to Nevill Hall will in future be closer to Hereford. Within Mid and South Powys, we're a large area, so our residents in Ystrad Gynllais are closer to Morriston Hospital. As we head up towards Rhaeadr, Llanidloes and Machynlleth, then we've got communities that look to Aberystwyth for their care. And the Grange Hospital may well be somewhere where some of us also receive some of our care. For instance, if we arrived at Nevill Hall Hospital with a minor injury and they decided that it was something more serious, then in normal circumstances, they're going to transfer us straight and quickly to the Grange University Hospital in Cwmbran, because they will have quick, seamless transport and referral routes between the Nevill Hall Hospital and the Grange University Hospital to make sure that we receive time-critical care in the right place from the right team at the right time. And it's important to remember too that we have a strong network of nurse-led minor injury units here in the county as well. Brecon Hospital is a 24-hour-a-day minor injury service. In Landrindod Wells, we've got a daytime service that's open until midnight, 7 days a week, and Ystrad Gunlais, a daytime service open till 4:30 Monday to Friday. And Nevill Hall Hospital will in future be a nurse-led minor injury unit as well. Now, obviously, again, one of the big issues that we'll want to make sure that we know what to do about is caring for children with illnesses and injuries. So the key guidance really is, if there's a serious illness and injury, then dial 99 or go to A&E. Go to one of those A&Es listed above, whichever one's closest for you. And that applies to all children of any age, whether they're under age 2 or age 2 and over. For minor injuries, then children under the age of 2, we recommend that they go to A&E, or you can dial 111 for urgent care advice. Children over the age of 2 can go to our minor injury units here in Powys, and they can treat minor injuries for children from age 2 and over, and all ages of adults. There's a little note there as well to say that Nevill Hall Hospital can also provide minor injury care for children aged 1 and over. And clearly, if they find that there's an illness or condition that's being presented in their minor injury unit that their nurse-led team there cannot deal with, then they have rapid transfer arrangements in place to the Grange University Hospital to provide comprehensive care. Next slide, please. So this is just a map that illustrates where those services are. So you can see the locations of the minor injury units and the map that will be in place for A&E services from the 17th of November once these changes happen. And a map like this will feature in a newsletter that we'll be sending to households right across South and Mid Powys that should be landing on people's doorsteps around the 2nd of November. That will provide more information to every household about these changes and particularly about what to do in an emergency. Next slide, please. So as well as emergency care, one of the areas of services that will be changing is maternity care. So the options that people will have will change slightly. So Powys Teaching Health Board, we continue to offer midwife-led home births, and we've got our midwife-led birth centres in Brecon and Llandrindod Wells, Knighton, Llanidloes, Newtown and Welshpool. So those continue to be options available for our residents. Nevill Hall Hospital will no longer provide consultant-led births, and that's from the 10th of November. We understand that will be slightly ahead of the main changes to the Grange University Hospital. So temporarily, those births would be taking place at the Royal Gwent before the new maternity facility is established at the Grange University Hospital from the 17th. And what we do recommend is that women who are currently booked with an Bevan University Health Board maintain continuity of care with their current team at ABUHB. So people who might have been booked to give birth at Nevill Hall, carry on with your team of care for your delivery at the Grange University Hospital. If there are reasons that's not appropriate to you, please talk to your Powys midwife. Your Powys midwife is here to be able to talk to you about your birth options now and in the future. And so again, from the 17th of November, once all of those changes are in place, women and families will be able to continue to access consultant-led maternity care from a wide range of neighbouring hospitals, including Prince Charles, Glangwili, Singleton, Bronglais, Hereford, and also the Grange University Hospital in Cwmbran. Next slide, please. So clearly for us, one of our big priorities with these changes that clearly, as I said, are coming about in the context of COVID, something that we couldn't have predicted, and the changes are happening ahead of schedule, far quicker than we had planned for. So we're making sure that we're having a big focus on engagement and communication. We want to help people make the best choices for caring for their sick child, so dialing 999, going to the nearest A&E. Help people make the best choices for themselves or for dependent adults in an emergency. Again, dial 999 or go to your nearest A&E. Inform people that if their current nearest A&E is Nevill Hall Hospital, that will change from the 17th of November. Let people know about changes to their birth options. Provide the opportunity to reassure people that most aspects of planned care remain unchanged. If you have appointments within Powys, then those will continue in Powys. If you have routine appointments at Nevill Hall Hospital, then broadly those are continuing unaffected. Although we do recognise that the current context of COVID-19 is having a big impact on planned care. Clearly, we apologise for that. We're working hard to try and keep services running right across primary care and our own community services and in neighbouring hospitals, but we have to take steps to keep you safe and keep our staff safe. We'll also be sharing information about the location of the A&E and maternity hospitals and sharing information about other options for support as well. So those are some of the key areas we'll be focusing on in engagement and communication. And next slide, please. And as I mentioned earlier, one of the ways that we'll be doing that is delivering the information that's in these slides and with more detail to households right across the area. Those will also go to business addresses as well across South and Mid Powys, and that's due to be in households at the beginning of November. Information will also be shared through print media and social media, and we'll have syndication packs for local organisations to share through your own channels. So I can see that we've got a comment in the sidebar asking if the slides will be available to print. Yes, we'll be sharing with town and community councils this information. As I said, the video of this slide will be available to watch online for people who weren't able to attend today. We'll have posters and other information that you can share through your channels locally as well, and to help let your communities know that the household drop will be coming and to look out for it. Because I know full well that sometimes when things come through our door, particularly if it's not directly addressed, it can be easy to ignore it. So we really want people to look out for this particular newsletter, keep hold of it. It'll have a tear out and keep sheet inside the front page. That's the kind of thing that you can stick on your fridge or stick on your cupboard with the main messages. It'll have a map in the centre pages to outline where the main A&E and maternity hospitals are. So we hope it will provide a wide range of useful information to people when these changes come. And obviously what we want to do is continue to reinforce these messages as well. So during November and December, to continue to let people know how these changes are, because often the first time that we'll need to actually engage with this information is when we need to access a service. So it's really important that people know where to go, particularly in an emergency. And then we recognise the very rural nature of Powys, that each of our market towns has a very different identity and culture. What we're looking to do in 2021, early in the year, is to refresh some materials that we'd started just before COVID that are called My Healthy Town, or My Healthy High Street. So they provide information about the services available in each market town, in pharmacies, in opticians, GP practices in the third sector that help us get access to care as close to home as possible. We'll also be providing our information in a range of language and formats so that we can reach out to people who may have barriers to access information. Again, in other times, we'd be anticipating spending the next few months in supermarkets and other high footfall areas to be able to share messages about these changes. Clearly, those opportunities are not available in the same way as they were pre-COVID, and so we're hence very, very reliant on using things like print media to be able to get information direct to people's front doors with these changes coming. So next slide, please. So just wanted to say thank you to everybody for attending. And I can see that we've got some comments in the comment bar as well. So will the slides be available to print, and will they be made available to the general population? Yes, very, very happy to do that. And to make it available to all the town and community councils, particularly those also not able to attend today. And what specific additional paramedic or other support will be put in place for acute emergency treatments where they are time critical access to A&E? So clearly what we've been doing is working very closely with Welsh Ambulance Service. And there's a lot of potential myth and misunderstanding about the concept of a golden hour. Some treatments are time critical, but the time critical nature of that is primarily dependent on the time when we first see a paramedic in the first place. So the access to the paramedics is really important. We've been working over the last few years as an NHS in Wales to strengthen the service provided by Wales Air Ambulance. They are starting to expand their service hours and are looking at ways of making that a 24-hour service. Wales Air Ambulance is so important for us here in Powys, given our rural environment, and it helps provide really rapid access for the most critical injuries and to take people to where their definitive treatment would need to be provided. As I said, we're working with with Welsh Ambulance Service as well, so the land ambulances, their paramedics, their rapid support teams, so that they are taking account of these changes and making sure that their services are ready as well. And similarly, our neighbouring hospitals, such as Prince Charles Hospital as well. So whilst this timetable has been very accelerated, we've been meeting very regularly with those partners in order to make sure that the system is ready for the changes that are coming. Just to reiterate, the changes have been planned and in progress for a long time, leading back to the decisions first from Clinical Futures and then from the South Wales programme. So this is something we have been planning for. The timing has just come forward by 4 or 5 months in the context of COVID to help us prepare for a COVID winter. I think another key part of the answer to the question from Terry as well is the role of major trauma networks. So one thing that has become really clear over the last few years is that when people have the most severe injuries, and I'm talking about sort of major multiple organ injuries, from, for instance, road traffic accidents, serious trauma, gunshot wounds, then the best place to be is something called a major trauma centre. And a major trauma centre will typically have at its disposal 24-hour access to expert vascular surgeons, expert cardiac surgeons, expert chest surgeons, expert neurology surgeons, so that whatever injuries that I might have succumbed to from my accident, I've got the team there 24 hours a day to treat me. And so recently, just in September, a major trauma network has been established for South Wales. Prior to that, South Wales was actually the only part of England and Wales that didn't yet have a major trauma network. And as part of that major trauma network, the University Hospital of Wales in Cardiff is our designated major trauma centre. So that's where the team will want to get us to for those most severe of injuries, because the team is there to make sure that we've got the best chance of recovery from those injuries, the best chance of surviving with reduced morbidity, reduced disability, and the best chance of recovery as well. So that major trauma network has a major trauma centre in Cardiff, and it has what's called trauma units. So those are the next tier down of hospitals that can treat most of the severe injuries, because it's very rare that any of us would ever need to be at a major trauma centre. Those are very rare injuries. Most injuries can be treated at a trauma unit, which would include, for instance, Prince Charles Hospital, or the Grange Hospital in Cwmbran will be a trauma unit as well. And as well as having access to those services in South Wales, we also have access to trauma facilities across the border in England as well. So Hereford Hospital is also a trauma unit, as is the Royal Shrewsbury Hospital in Shrewsbury for our residents in North Powys. And those link into major trauma centres in Birmingham and Stoke for those most serious, very, very critical injuries. So a lot of work has been taking place in order to ensure access to time critical care, and clearly those are exactly the sort of areas that we'll be keeping under careful review when these changes are implemented as well. So thanks for that question, Terry. And Philip's asking, how can we access this indication packs? So just putting the finishing touches to the packs of information to send out to people. So we will make sure that information is initially emailed out to all town and community councils. We do want to follow that up with some print copies as well. But as soon as possible, ideally this week, and certainly no later than the beginning of next week, we'll have packs of information being sent out for for you to share with your members and share through your channels. The power of Facebook, particularly during COVID, it's really come into its own. So those mechanisms are a really great way to share information. But again, we recognise that not everybody has access to social media, to computers, recognise that in parts of Powys, particularly broadband, can be challenging. So therefore, that's why we felt it was particularly important to make sure that we had information sent to every household across the area as well. Now, I think those are the main questions we've had in our sidebar so far. Tin, forgive me if I've missed any. Is there any to bring to my attention?
No, you've answered all the questions that we've received.
Fantastic. Well, there's an opportunity now if people want to add any further questions into the sidebar. And obviously, as I said, we'll be writing out to town and community councils again very, very shortly. That'll be a further opportunity. Hopefully the information that we provide will answer many of the questions that you have. But if there are other issues that are raised that you're looking for answers to share with your communities, then please do get in touch. I've been a community councillor myself in the past. I'm not at the moment, but I know how important and valuable a role it is within our local communities, and those important community connections and that vital community support that we offer, and also that our residents can look to us for information and advice, and also to escalate issues to those in power and those who make decisions. And if there were things that came up today that you didn't get a chance to ask as well, it's actually our annual general meeting taking place on Thursday afternoon. There's information available on our website about that, and you'll be able to join and watch online in a similar way today. So as there's no further questions coming in, I'll pause there and say thank you so much to everybody for taking part today. It's been a very interesting experience to shift into a digital arena rather than providing these briefings face to face. Our intention is that we'll be aiming to provide regular updates to town and community councils across the area, and potentially to look to do something like this every quarter, and not necessarily just on a single issue such as the changes to Nevill Hall Hospital, but provide opportunity to provide a broader update about the opportunities and challenges facing health services in Powys and how we can work together to ensure a healthy, caring Powys. So thank you very much, everybody. Stay safe, and thank you for everything that you were doing during the response to COVID-19 to stay home, save lives and protect the NHS. Thank you all.